Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I'm bringing a solo episode for you, and this is marketing to the active care patient. And I want you to kind of think about it more as communicating with the active care patient. And that's typically what marketing is, especially when you're doing ethical, elegant marketing, content marketing, education based marketing. It's going to be all about communication. And, there's three phases to a patient life cycle. There's the new patient, right? That's part one. Two is the active care patient, and three is the inactive care patient. And you should be doing marketing for all three phases of that patient life cycle. But today we're going to dive into the active patient, right? That active care patient, and give you some ideas to communicate well with them. And the reason why you want to do this, honestly, is it all comes down to patient outcomes. Everything is about patient outcomes, especially for the evidence-based chiropractor. We want to be patient-centered, but the reality of it is, we can be patient-centered, we can be outcomes driven and do it in a way that, yeah, it helps our practice, it helps it grow, it helps it thrive, it helps it have profit margins that you can reinvest in yourself and in your team and in your patients and ultimately provide a great experience. It's okay to make decisions that are both patient centered and good business decisions and good strategy to have a healthy practice. And I think this phase of the patient life cycle goes unnoticed sometimes. We think a lot about new patient marketing and we think about reactivations, and that's kind of that phase 1 and 3 that I mentioned, right? So new patient and then inactive patient. We hear a lot of people talk about reactivations, and those are all great. But this active care patient, this stretch of time with your patient goes unnoticed from a let's just call it, communication and marketing standpoint. And the active care patient is obviously from when they come into your office for the initial exam all the way until they are discharged from care. Even if you put them on a performance or maintenance care, that's fine. That's going to be after the active care. And so we're going to define it as from first visit to discharge from care as the active care patient. And what's going to happen is if you do effective content education, marketing, whatever you want to call it for that patient, three things are going to happen. You're going to increase the adherence, the patient adherence to that treatment plan, which is frankly going to optimize their patient outcomes. Right? A lot of times, patient outcomes suffer because you have a leak in the bucket, and patients are not adhering to a standard of care that is good for them, and so you're having outcome issues there. The second thing it's going to do is they will potentially utilize more services that you believe in, right? Services that are going to help them. It might be services, it might be products, right? And that's fine. You shouldn't be shy about having add-on services that are going to help your patients. And then third, it's going to actually help you get more referrals. The way it gets more referrals is the fact that a patient refers people to you. The most opportune time for them to do that is during their active care plan with you, right? Like if they're with you for a month, that is the most likely referral time period that they're going to send friends, family, and colleague members to your practice. And so if you do a great job of educating your patient during that period of time, there's going to be a higher chance that they refer more. If they get an email from you and they're like, oh, I didn't know you treated TMD, TMJ, they probably don't know what TMD is, right? But or plantar fasciitis, if you're giving them like information on some of the things that you treat, they're going to know how to refer to you. So those are the three things that really good communication and marketing to the active care patient does. One is increase patient adherence. Two is increase utilization of services, and you're going to get more referrals, right? And that's just a key aspect of building a sustainable and thriving practice that has different, um, different peaks and valleys. And we want to really get the peaks higher and the valleys higher as well, not lower. So we want to make sure we smooth out that a little bit. And the patient adherence, I think, is one of the biggest things chiropractors struggle with, and it really impacts your outcomes, like I mentioned, and it just impacts your business too. And there's a handful of things of why a patient prematurely falls off. It could be financial, right? If you have higher prices, if you're at a network, um, probably going to happen more often to you than if you are in network with all the insurances or your particular state has lower copays and lower deductibles. So, finance is definitely a part of that. Um, maybe there's a time issue. Maybe you're too busy and there's not enough availability for them. There's a lot of things you got to look at from that perspective as well. Maybe they're not getting better after they gave you 3 or 4 visits and they're not better, and they weren't properly educated on what their low back condition was going to be like. And so maybe that happens. Or sometimes they actually feel better. They get better pain wise, but maybe they're not better function wise. And you got to be able to explain that to them. Maybe they're just not bought into what the experience is or the guidance you're giving them. And those are the things that you really have to make sure your communication is on point to really improve this. Okay. So I want to dive into 7 things that you could improve on or do to communicate with that patient. And this is more about really educating them. There's other ways of communicating. Obviously, like an appointment reminder text is a way of communicating, but that's not necessarily marketing. That's a good thing to do, but I'm not going to dive into that type of stuff as procedural. Okay. So the first thing is your report of findings. You got to have a great report of findings, and I think a lot of chiropractors struggle with that. We actually just did our one of our big coaching calls here this week on report of findings, and how we story branded, asking the Dan Sullivan R factor question at the history, having confidence in what you're providing them. We go over the clinical compass, evidence based guidelines for treatment frequency and duration. A lot of things that we have a very nice step by step approach for a report of findings that isn't browbeating anybody. We're not having this big dog and pony show. You don't have to bring the entire family to a report of findings. It's actually just being a really good doctor and having great communication with them and having an effective way of talking to them and giving them the particular information they need to feel good about the guidance that you're giving them and the leadership that you're providing for them. And so you got to get really good at your report of findings and do it. I mean, it takes us like 3 to 5 minutes, and it's a nice dialogue. It's not drinking water out of a fire hydrant. It's not 25 minutes, and it's not a sales job. And so report of findings is a big one. So that's number one. We work with our clients a lot on the report of findings, and especially if you have associates that need to improve on that, we do a lot with that as well. Number two is consider a really nice new patient packet for your new patients, right? Have information on there, some of the other services you do. If you have something like Cairo Up, I recommend putting the condition report in there. It doesn't have to be this huge big thing, but it could be a nice little packet or folder with pertinent information. If you offer things like shockwave or laser or whatever, have information about there. We also we have those healthy info cards, which actually you can get for free on our website. Go to modernchiropracticmarketing.com. There's a resources tab and you'll see healthy info cards. We have micro break cards, desk ergonomics cards, carpal tunnel stretching. So basically, it's for the desk worker. We also have certain things on there like the core exercise card, and you can actually download that. It's PSD files and send it to your graphic designer, and you can rebrand it and put your clinic information on it. And we print it out on these really nice cardstock, and so we give that to our new patients, the pertinent ones. I think we have 5 on there, and so we pick whatever ones that make sense for that patient and give that to them. So consider a nice little new patient packet with some good educational materials. Let's take a break from today's episode and announce our first sponsor. This is going to be Propel Marketing and Design. I've known Darcy Sullivan for years. We've worked hand in hand on my websites. I don't trust anybody else to do the search engine optimization. She does a great job. There's so much to it. A lot of the lingo and the words are beyond my comprehension, but it's just amazing work that she does. And if you're really going to get results with Google, you have to make sure your website is SEO optimized. And I really don't want you doing it yourself as a chiropractor. So you just have to have this type of stuff done. And if you're looking to get more organic online traffic that pulls in new patients, Propel Marketing and Design is currently offering chiropractors who listen to this podcast a free SEO website review. The free review will help you uncover methods that will improve your website and boost your search engine visibility. Head over to propelyourcompany.com/chiropractor and schedule your free SEO website review. You won't regret it. She gets great results. Your website needs this. Your search results need this. Head on over there to propelyourcompany.com/chiropractor to get your free SEO website review. The next one we do is I use an app called Bonjoro, and it's $25 a month. It's free at first, and you get to a certain point, then it's $25 a month. And basically, it's a video app. It does other things, but what I do is we get a new patient, and then that next morning I will shoot a quick video. It's just me holding my cell phone up, kind of like selfie style. And for like 30 seconds, like, hey, John, this is Dr. Christie. It was a pleasure meeting you yesterday. We're looking forward to get you back to playing some golf. Don't worry if you're a little sore. That can happen sometimes. Not a big deal. Typically, that'll go away. Make sure you do the stretches we gave you, and we look forward to seeing you on your next visit. Right. So it's a personalized little video. And then what happens is from the app, it emails to them, but when they open up the email, it's a nice video that's embedded into the body of the email, like a thumbnail, and they can click it and watch it right in the email. So it's not like an attachment. And it's just a nice thing. It's kind of in lieu of calling your new patients and seeing how they're doing. That's fine too. That's really good. A lot of people obviously just go right to voicemail, but you can leave a voicemail. But this is my way of doing it to where honestly, I just don't want to necessarily get on the phone and have conversations with all the new patients. But there's nothing wrong with that. But the Bonjoro has been a really nice touch, and we get a lot of great feedback from there. And that's one of those touch points that's, um, I think it's important. I wouldn't necessarily call it, it's not a ton of content education, but I do try to put something in there where I want to reiterate, like, don't worry if you're sore, or don't worry if the pain doesn't go away, or whatever it is, like something that might cement for them, like, okay, I'm in the right place. And so that is spelled Bonjoro. So Bonjoro. Next is an email onboarding sequence. My first caveat to this is if you get a new patient that signs up your practice and they get a slew of emails with paperwork, and then they're getting email reminders for the appointment, and they're getting text messages, you may want to avoid this. You want to audit how much communication they're getting before they even come in, or that first few weeks of care. But you could do a nice email onboarding sequence. We have one, and it's 4 emails, and it drips after, like, they've come in the practice, they've been in one time, their email gets sent in, and then from there, they will get a welcome email, and then the second email will be about, a lot of the low back conditions we treat. Then the third email will be a lot about the neck conditions we treat, even though we treat a lot of stuff, those are main things. And then the fourth email is actually an email of some of the other services we have. So we're educating them on some of the main conditions we have, and then obviously some of the services. And so you could do an email onboarding sequence with MailChimp. If you're a member of our Chiropractic Success Academy, we have a lesson in there on that. But MailChimp, if you have, or whatever you use, will walk you through that and help you out. Let's take a short break for one of our great sponsors, TrackStat. It is a new type of software plugin for your EHR that combines patient communication, marketing, automation, and statistics with patient and employee tracking. Built by chiropractors for chiropractors, it shows your team what to focus on each day. See patient visit habits, missing information, unpaid bills, insurance collection visit average, and more. Great visibility of data so you can focus on filling your office with your best patients. When you can see what your staff and patients are doing or not doing and take action accordingly, your profits naturally grow. Take TrackStat for a test drive in your office with our free trial. Not a techie, no problem, we can help. To get started on your free trial, visit trackstat.org and watch the demo. That is trackstat.org. Fifth, I think, is a nice new patient tour. All right. Again, if you have cool services, maybe you have a clinic gym hybrid or you have shockwave or laser or dry needling or a stretching person, whatever. There's a lot of things you may have. Um, Give a nice tour, especially if you're proud of your office. Do a new patient tour. Make sure you show them the different opportunities they have in your practice as far as health. Maybe a functional medicine doctor or some integrated medicine, whatever it may be. Heck, even if you rent out, to like we rent out to a physical therapy group and we have a massage therapist. And so we will mention them in our tour. And so consider a new patient tour that is not overly done, but nice and gives them a little walkthrough of what to expect and then some of the services you have, right? The next thing that I like doing is we send a welcome letter to our new patients, and we have kind of a template through there. Again, we coach our clients on this, how to have a tailored but templated welcome letter. And so I'm sending them a Bonjoro video, and then they're getting a letter a few days later in the mail. Like we're really welcoming to our practice, and we're communicating with them, and we want them to feel like they're in the right place and they're getting a remarkable experience. So consider that welcome letter in the physical mail. So mail it to them. And then lastly is there's a lot of opportunities to send your patients videos or blogs that you've done as content, right? And so some of the examples I give for this is if a patient asks me about mattresses, we have a whole mattress buying guide on our blog. So I'll go over to my computer, I'll snag that from our website and I'll email it right to them through our EHR system directly. Or we get a runner I ask them if they do a pre-run warm-up and they don't. So I walk over to our YouTube channel, get the link to a pre-run warm-up we did and email it to them right through the EHR system. Another one is people with low back pain and they got an air travel coming up. We wrote a blog on how to travel via plane when you have back pain. I'll go over and I'll email it to them. So you can use the content you have to educate them during their active care patient experience. And that way it helps educate them. And it's a great opportunity to improve their outcomes. And so just to reiterate, you got seven, and I'm sure there's more, but I'm just going to start with these seven. Make sure your report of findings is on point. Consider a new patient packet. Look into Bonjoro. Onboarding sequence could be done by your email platform, not your EHR. New patient tours can be really nice. Welcome letter in the physical mail, in the mailbox. I know it's hard for you to believe that. Sometimes you can send mail in a mailbox. And then lastly, educating your patient through your videos and blogs that you have done. And that will be a really good, it's just a comprehensive strategy to get education and communication to your patient during that active care phase, which again is from new patient to doctor discharge. I hope that helps. We'll probably do some other solo episodes where we tackle a little bit of new patient cycle and then also inactive patients. Have a great rest of the week. Talk to you soon. I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth. and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.